In this video, we're going to be taking a deep dive into 12 weird signs and symptoms of liver damage. These are very important signs to be aware of because you can stop this disease from progressing and getting worse as your liver is able to completely regenerate with a little help. Liver disease is a condition that is affecting over 25% of people worldwide, and this number is growing at a rapid rate. Most people believe that liver damage comes from only drinking too much alcohol, but the truth is it can also be caused by eating too many sweetened, sugary, or processed foods and drinks, by consuming too many omega-6 vegetable oils and fast foods, using painkillers too often like acetaminophen or ibuprofen. Viruses can cause damage and hepatitis in the liver. Having too much elemental iron in the body can be a problem, and also toxins from the environments like pesticides, plastics, petroleum, and the list goes on and on. So, if you'd like to find out if there are problems with your liver, watch this video through until the end, as we will also be exploring some natural home treatments to clean the liver and prevent the damage from getting worse. Disclaimer: this video is for educational purposes only, so do speak to your doctor if you have any medical conditions. The first symptom of liver problems is pale stools when you use the toilet. Your liver releases conjugated bile acids to help digest fats from your food, which give your stool its normal brown color. If you have fatty liver disease or liver damage, however, this bile stops flowing properly through the bile ducts, causing your stool to become lighter, paler, or clay-colored, and it may float on the top of the toilet water because of the undigested fat that's making it buoyant. Symptom number 2 is poor night vision. If you notice that it's much more difficult to focus or see at night time, especially where there's poor lighting, this may indicate a retinol or a vitamin A deficiency. The bile that comes from your liver helps you to absorb vitamin A to help the rod cells in your eyes adapt to different levels of light. Having liver disease, however, causes a lack of bile so that you don't absorb enough vitamin A, triggering what we call night blindness. This can also indicate that you have a congested gallbladder, especially if your eyes also feel very dried out, sore, irritated, and gritty. Sign number 3 is a swollen right foot. When the blood isn't flowing normally through your liver, it can become swollen and enlarged, which puts pressure on the portal vein. This causes fluid or water to accumulate in the legs or feet, and then when you press your finger into the swollen area, it may leave an indentation. If you notice that the right foot and your ankle is more swollen than the left, this is an extremely common sign that you may have liver damage, and you may want to use a natural remedy to improve its function, but we'll talk more about cleaning your liver later in the video. Jumping back to sign number 4 now, which is white eyelid growths. Another weird sign of liver damage is the appearance of white or yellowish growths around your eyelids. These are small pockets of cholesterol deposits that build up under your skin because your liver isn't breaking down cholesterol properly, causing it to back up into different areas of the body. Sign number 5 is right-sided pressure. Another sign that you may have liver disease is a feeling of pressure or pain on the right side of your rib cage, especially after you eat. Bile from your liver is turning into a sludge because of the liver damage, which is clogging up the little tubes connected to your gallbladder and causes a sensation of pressure and pain around the ribs. This can also put pressure on the phrenic nerve, causing muscle tightness and pain in the area around your right shoulder. Sign number 6 is purple and red spots. When your liver is congested, inflamed, or damaged, it produces less proteins that are needed for normal blood clotting. This means that you can bruise more easily, and quite often unusual purple or red bumps can appear as a rash on the skin, as well as small red patches. This often happens around the lower legs or the arms, and it's caused by the poor blood circulation triggered by liver disease, or possibly diabetes. Next up is cracked heels. Your body uses vitamin B3, commonly known as niacin, to keep your skin cells strong, smooth, and moisturized to prevent it from becoming damaged. If you have liver disease, however, your body uses up its vitamin B3 stores to help repair the damage. This leaves less of the nutrient available for other jobs, causing the skin on the soles of your feet and heels to start cracking. This can be overcome by loading up on vitamin B3 and fixing the root cause of the problem, which is fatty liver disease. Another symptom of liver disease is having the constant urge to scratch or itch the palms of your hands or the soles of your feet. This condition is caused by a buildup of bile acids under the skin, because the liver is not filtering them out properly, and this causes histamines to build up in the blood, causing the itchy reaction. Number 9 is all white or clubbed nails. If your fingernails begin to turn all white in color, losing their pink color, or they take on a rounded, clubbed, or bulbous appearance, this can indicate that there is some serious liver damage or another underlying health condition which is preventing oxygen from reaching the nail matrix. It was discovered in the 1950s that 8 out of 10 people with severe liver scarring had all white nails. Sign number 10 is dark urine. Your liver has the job of breaking down old red blood cells, which contains this yellowish pigment called bilirubin. Now, if your liver or the gallbladder becomes damaged, this pigment can start to build up inside the body, and then it can be flushed through the urine, causing your pee to have a very strong, dark, orange, amber, brown, or cola color, because your liver isn't breaking down the pigment normally. This can also be caused by certain medications that are weakening your liver, like antibiotic, sleeping pills, or birth control pills. 11 is yellowed skin. When your liver isn't working properly and filtering this bilirubin from your blood, the pigment can also start to change the color of your skin. This can cause a yellowish tinge to the skin called jaundice, which is a sign that there is some serious damage in the liver, such as hepatitis, cirrhosis, drug, or medication poisoning. So please, visit your doctor if this is the case. And finally, number 12 is spider veins. Spider veins look like small red dots with spider-like extensions of blood vessels that appear on the skin. These are blood vessels that have become damaged because your liver isn't doing its job in filtering out all of the excess estrogen. High estrogen weakens the blood vessels in the veins, causing them to dilate, and they become visible on the skin. If you have one or more of these symptoms that we've talked about here, it's highly recommended to visit your doctor and ask for an ultrasound test. This is a very simple, non-invasive test which uses sound waves to take an image of your liver and its network of blood vessels to find out if there are any fatty deposits building up inside. Fortunately, the liver is one of the only organs in the body that can completely heal and regenerate. How to reverse liver disease? As I previously mentioned, the liver has 4 different stages of damage. First, it gets clogged up with fat, then it becomes inflamed and begins to develop scar tissue called fibrosis, and then it develops into a more severe, life-threatening stage called cirrhosis. Fortunately, however, the liver has the ability to completely regenerate and heal itself when you fix your diet and use the right remedies. So let's go through the most important steps to reverse liver damage. 1. Clean up your diet by cutting back on sugary, starchy, and flour-based foods, like bread, biscuits, sweets, ketchup, pancakes, pasta, soda drinks, etc. A fatty or damaged liver is sensitive to fructose, which is fruit sugar, in the same way that it is alcohol, so it's important to stop drinking fruit juices and alcohol entirely. 2. Eat lots of bitter, sulfur-rich foods, like leafy greens, artichokes, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pasture-raised eggs, wild salmon, and other oily fish, walnuts, onions, scallions, and broccoli sprouts. Foods that are high in sulfur help to strip away fat from your liver by boosting glutathione levels and helping to detoxify poisons. 3. Drink 1 cup of organic coffee that's brewed at home each morning and then add 1 teaspoon of turmeric. The polyphenols found in the coffee and the phytonutrients in the turmeric reduce scar tissue formation in the liver, and they also help it to repair damage caused by alcohol, drugs, or fructose. You should also be drinking at least 1 liter of high-quality mineral water throughout the day, to help thin out your blood and help the liver to produce bile, in order to break down any fatty deposits. You can also add freshly squeezed lemon or lime juice to improve the filtration of toxins in your liver. In fact, I recommend that you get as many liver-cleansing herbs and spices into your diet as possible, such as ginger, turmeric, cinnamon, dandelion root, milk thistle, reishi mushrooms, green tea, and also cloves. 4. Eat all of your daily calories in a 6-hour window, allowing your body 18 hours to fast each day. I recommend eating all of your food between the hours of 12 p.m. to 6 p.m., but you can change this window to suit your lifestyle. This is what we call intermittent fasting, or timed eating, and it majorly improves the health of your liver by lowering inflammation and increasing insulin-like growth factor, a hormone that helps to prevent fat from accumulating in the liver. Fasting also stimulates autophagy, where your liver recycles old damaged cells and proteins to regenerate new healthy liver cells. 5. Stop eating all of the inflammatory seed oils, such as corn, cottonseed, canola, rapeseed, soy oil, cheaper processed olive oil, margarine, etc. Start eating anti-inflammatory fats instead, like extra virgin olive oil and virgin coconut oil, in your own home-cooked delicious recipes, as these have been proven to have liver protective properties. And finally, to clean out the fatty deposits and to lower inflammation inside the liver, take a purified bile supplement in the morning on an empty stomach. You can use TUDCA, purified bile salts, or a digestive enzyme blend that contains ox bile on the ingredients list. These not only help to eliminate fat from your liver, but they also prevent the formation of gallbladder stones. If you are serious about repairing your liver, there are also other vitamins and supplements that can be used.
Welcome back, dear viewers, to the Healthy Care channel. The liver, your body's silent warrior, plays a pivotal role in maintaining your overall health. It's akin to an air filter, detoxifying chemicals, and a powerhouse of energy, tirelessly ensuring that your body absorbs the necessary nutrients while protecting you from the toxins ingested daily. Moreover, this vital organ is responsible for producing proteins essential for blood clotting, making it an indispensable part of your existence. In today's segment, we're diving into a crucial topic that everyone needs to pay attention to: foods that are detrimental to your liver's health. Surprisingly, some everyday items on your menu, such as alcohol, raisins, canned foods, and red meat, are among the culprits that can wreak havoc on this crucial organ. Stay tuned as we unravel the dietary choices that could be undermining the health of your liver, and what you can do to turn the tide in favor of your well-being. 1. Sugar. Your body might be asking for that sugar rush, but hey, let's talk about why we need to keep those cravings in check. Overloading on sugar isn't just a no-no for your waistline, it's a red flag for your liver too. Yep, you heard it right. Gorging on too much sugar can set you on a fast track to obesity and diabetes, both of which are VIP tickets to developing fatty liver disease. Now, research is all in agreement here: cutting down on sugar can be a game changer for your liver health, steering clear of fatty liver disease. Here's a sweet fact for you: sugar breaks down into fructose in our body. But when there's too much going on, this fructose gets stored as fat, right in the liver, putting it under more stress. Sugar is pretty sneaky, hiding in everyday processed foods like your favorite cookies, cereals, cakes, juices, and even in those fizzy sodas. And it's not just the obvious culprits. Sugar plays hide and seek in places you'd least expect, like salad dressings and ketchup. Always check the sugar content on labels before you throw anything into your shopping cart. While the natural sugars in fruits and certain foods get a green light for liver health, moderation is key. So, next time you're about to indulge, remember it's not just about counting calories, it's about making every calorie count for your liver's health. 2. Excessive salt intake. Anything taken in excess can lead to harm, and salt is no exception. While salt is commonly associated with elevated blood pressure, it can also inflict damage on various parts of the body. Recent studies have revealed that consuming too much salt can lead to liver scarring. Fortunately, antioxidants such as vitamin C can mitigate this damage. It is advisable to steer clear of high-sodium foods and incorporate new items into your diet. Opt for foods rich in vitamin C, such as strawberries, kale, and bell peppers. Make an effort to avoid processed foods like ham, bacon, and deli meat. Choose fresh vegetables over canned varieties and experiment with using herbs instead of salt during cooking. Additionally, remove the salt shaker from the dining table. 3. Raisins. While raisins are often touted as a nutritious snack, consuming them excessively can have adverse effects. Despite their natural sweetness and some health benefits, including dietary fiber and certain vitamins and minerals, overindulging in raisins can be counterproductive to your health. Raisins are high in sugar, preservatives, and calories. Moreover, they can contribute to inflammation in the lining of your liver if consumed in large quantities. While they may seem like a healthier alternative to indulging in candies like Skittles, moderation is key. 4. Sodas. Sodas, often laden with high fructose corn syrup, pose a significant threat to your liver health. This sweetening agent, commonly found in many soda formulations, is particularly detrimental to liver function. Even if sodas are sweetened with sugar instead, they still pose risks to liver health. One critical function of the liver is to convert sugar into fat. Consuming excessive amounts of any type of sweetener, whether it be high fructose corn syrup or sugar, can overwhelm the liver's capacity to process these sugars efficiently. This excess sugar conversion ultimately leads to the accumulation of fat in the liver, a condition known as fatty liver disease. 5. Fructose. While foods rich in sugar such as raisins and juice may be enjoyable, they can be detrimental to liver health due to their high fructose content. Unlike other sugars, fructose does not metabolize in the body in the same way, posing unique challenges to liver function. Consuming excessive amounts of sugar, including fructose, can lead to dyslipidemia, characterized by abnormal levels of fat in the blood. Studies have indicated a strong correlation between fructose consumption and conditions such as fatty liver and inflammation. While moderate consumption of fruits which naturally contain fructose is beneficial, excessive intake can pose problems for liver health. Therefore, it's advisable to exercise moderation and avoid overindulging in foods like raisins, juice, trail mix, or honey, which are high in fructose. 6. Trans fats. Partially hydrogenated oils, the source of trans fats, continue to persist in many processed foods despite increased awareness of their harmful effects. These oils can be found in a wide range of products such as store-bought frosting, crackers, cookies, salad dressings, and microwave popcorn. Consuming even small quantities of trans fats can elevate levels of bad cholesterol in the body. What makes trans fats particularly concerning is that they are efficiently processed by the liver, leading to a significant buildup of bad cholesterol within this vital organ. This accumulation heightens the risk of liver disease over time. 7. Fried foods. Your liver plays a crucial role in breaking down nutrients, but when it becomes overwhelmed with fats, its efficiency is compromised. Fried foods and other high-fat items can contribute to the development of fatty liver disease, making it advisable to limit their consumption. The excess fat from these foods can lead to inflammation and scarring, resulting in permanent damage to the liver's ability to process nutrients efficiently. 8. Packaged snack foods. When the craving for packaged snacks strikes, consider reaching for a healthier alternative instead. Chips and baked goods, while convenient, are often laden with unhealthy amounts of sugar, salt, and fat. Consuming foods high in sodium can lead to fluid retention in the liver, impeding its function over time. Additionally, many processed snacks contain trans fatty acids, which contribute to the development of fibrosis. This condition involves the formation of scar tissue in the liver, replacing healthy cells and potentially leading to serious complications such as cirrhosis or liver cancer. 9. Fast food. Indulging in your favorite fast food meal may seem satisfying, but it comes with a double dose of health risks. Fast foods are typically laden with refined carbohydrates and fats, a combination that spells trouble for your liver health. A diet high in refined carbohydrates can contribute to the development of fatty liver disease. These carbohydrates cause sharp spikes in blood glucose levels and trigger a significant release of insulin, leading to the accumulation of fat in the liver. Moreover, consuming foods high in fats, especially in excess, can raise levels of bad cholesterol while reducing the beneficial kind. This imbalance in cholesterol levels further compromises liver health and increases the risk of related complications. Next time you're tempted by greasy cheeseburgers and other fast food fare, remember the toll it can take on your liver and opt for healthier alternatives instead. 10. Simple carbohydrates. Simple carbohydrates, often devoid of essential nutrients due to extensive processing, pose significant risks to your health. These refined carbs have the tendency to rapidly elevate blood sugar levels, triggering the body to release insulin. Over time, this can lead to insulin resistance, a condition where the body's cells become less responsive to insulin's signals. As insulin resistance progresses, the risk of developing fatty liver disease increases. Common sources of simple carbohydrates include white bread, white noodles, cakes, cookies, pastries, and crackers. Regular consumption of these foods can contribute to metabolic imbalances and liver dysfunction. 11. Alcohol. Alcohol consumption poses a significant risk to liver health, with alcoholic fatty liver disease being a common consequence of excessive drinking. Under normal circumstances, the liver can process approximately one standard drink, equivalent to about 10 to 15 grams of alcohol within an hour. However, consuming alcohol beyond this limit and doing so frequently can lead to the accumulation of fat deposits in the liver. Alcoholic fatty liver disease may not manifest obvious symptoms, making it imperative for detection through medical evaluation such as blood tests or a biopsy. Furthermore, alcohol can exacerbate the progression of pre-existing liver conditions. One of the liver's primary functions is to metabolize alcohol. However, continued alcohol consumption in the presence of liver damage impairs the organ's ability to effectively metabolize alcohol, exacerbating liver damage further. 12. Red meat. Consuming red meat can have negative implications for liver health, particularly for individuals with serious liver conditions like cirrhosis or hepatitis. Red meat contains saturated fats and other substances that may contribute to the development of non-alcoholic liver disease over time. Additionally, the metabolism of red meat places a significant strain on the liver due to its complex proteins and fats. Research suggests that individuals who are overweight and consume high amounts of animal protein, such as that found in red meat, are at an increased risk of developing fatty liver disease compared to those with lower consumption levels. Given these concerns, it's advisable for individuals with liver diseases and those looking to protect liver health to limit their intake of red meat. Instead, opting for lean protein sources like poultry, fish, legumes, and plant-based proteins can help reduce the burden on the liver while providing essential nutrients. Prioritizing dietary choices that support liver health can contribute to overall well-being and mitigate the risk of liver-related complications. Welcome to our Healthy Care channel, where we'll be discussing the top 10 medications that cause liver damage. The liver plays a crucial role in filtering and processing harmful substances in our bodies. However, certain medications can lead to severe liver damage, and it's important for us to understand them to protect our liver health. In this video, we'll delve into these medications and provide information on the early symptoms of drug-induced liver damage. The last one is the main one, so stay until the end. This will help you recognize and respond promptly to any signs related to your liver health. The 10th medication on our list is the combination of amoxicillin with clavulanate, a widely prescribed antibiotic known for its effectiveness in treating various infections like sinusitis, tonsillitis, pneumonia, and urinary tract infections. Despite its efficacy, there's a significant concern associated with this medication. It has been linked to numerous cases of acute liver injury, a serious condition characterized by sudden liver damage that can have severe consequences if not promptly addressed. Therefore, it's crucial for healthcare professionals to be mindful of this risk when prescribing or administering amoxicillin with clavulanate. Patients should be closely monitored, especially if they're using the medication for prolonged periods or in high doses. They should also be educated about the signs of liver injury and advised to seek immediate medical attention if they experience symptoms such as jaundice, dark urine, extreme fatigue, nausea, vomiting, or abdominal pain, as these may indicate liver problems requiring urgent intervention. The 9th medication known to potentially harm the liver is diclofenac. While all anti-inflammatories, like ibuprofen and naproxen, carry a slight risk of liver damage, it's relatively rare. However, diclofenac is particularly notable for its higher risk compared to other anti-inflammatories when it comes to causing liver injuries. Liver damage from diclofenac can occur weeks or even months after starting to use the medication. Hence, it's crucial to understand that diclofenac not only affects the kidneys but also poses a risk to the liver. Stay vigilant about any symptoms and consult a healthcare professional if you experience any concerns while using this medication. The 8th medication we'll discuss is amiodarone, also known as Ancarone, commonly prescribed by cardiologists to manage cardiac arrhythmias. This medication stands out for its effectiveness in significantly improving arrhythmias and even clearing 24-hour Holter records. However, it's essential to recognize that amiodarone carries one of the highest indexes of side effects among medications. It can impact various organs, including the thyroid, lungs, skin, and yes, the liver as well. Due to this extensive range of potential side effects, its usage has become more restricted compared to the past, reserved for specific cases where the benefits outweigh the risks. While amiodarone typically doesn't cause acute liver injury, it's important to note that its harmful effects on the liver may take weeks to months to manifest. Healthcare professionals and patients alike should remain vigilant for any signs of liver problems while using this medication and report any concerns promptly to their healthcare provider. The 7th group of medications that can potentially affect your liver are anticonvulsants. Specifically, medications like phenytoin, commercially known as Hydental, and valproic acid, known as Depakote, are noteworthy for their association with liver damage. Hydental has been observed to start causing liver injury immediately after initiation of treatment, while the effects of Depakote may become apparent between 1 and 6 weeks into therapy, underscoring the importance of regular monitoring of liver enzymes. In addition to these, carbamazepine and lamotrigine are also recognized for their potential to cause liver injuries, although such occurrences are much less common. Thus, individuals prescribed these anticonvulsant medications should be vigilant about any signs of liver dysfunction and ensure regular liver function tests to monitor their liver health closely. The sixth medication known to potentially cause liver injury is allopurinol. Often prescribed for individuals with elevated uric acid levels or those suffering from gout, especially when dietary modifications alone aren't sufficient to manage the condition. Allopurinol effectively lowers uric acid levels in the body, thereby preventing gout attacks. However, it's crucial to understand that allopurinol can have adverse effects on the liver. Liver injuries associated with allopurinol use can occur rapidly, sometimes within days or weeks after initiating treatment. Hence, patients starting allopurinol therapy should undergo careful monitoring for any signs of liver damage. Regular medical follow-up is essential to promptly detect any issues and adjust the treatment plan as needed. Additionally, patients should promptly report any unusual symptoms that may arise during allopurinol use to their healthcare provider. Despite these risks, it's important to note that allopurinol remains a valuable therapeutic option for many patients with gout or elevated uric acid levels. However, its usage should be managed cautiously, with close attention paid to liver health. The fifth medication of concern is methotrexate, a widely utilized treatment for various conditions including rheumatoid arthritis, psoriatic arthritis, and certain types of cancer. One crucial aspect of methotrexate use is the necessity for continuous monitoring of liver enzymes due to the common occurrence of liver injury associated with this medication. Liver injury induced by methotrexate can span from mild to severe, and in severe cases, may result in significant liver damage if not promptly identified and managed. To mitigate these risks, healthcare providers typically conduct regular liver enzyme tests for patients on methotrexate. These tests serve to promptly detect any signs of liver damage, enabling adjustments in medication or treatment strategies to prevent major complications. Adhering to medical guidelines regarding methotrexate dosage and frequency of use is paramount in minimizing the likelihood of adverse effects, including hepatic ones. In certain scenarios, depending on the patient's health status and response to treatment, healthcare providers may explore alternative therapeutic options to mitigate the risk of liver injury associated with methotrexate. The fourth category of medications that can potentially impact the liver is antifungals. Specifically, fluconazole and itraconazole, commonly employed in the treatment of candidiasis and nail mycosis, are associated with hepatotoxicity in certain susceptible individuals. Given this association, it's crucial for individuals using these medications to treat mycosis to be vigilant about recognizing signs of hepatic toxicity, as mentioned earlier. Prompt identification of such symptoms can facilitate timely intervention and management to mitigate the risk of liver damage associated with antifungal therapy. The third group of medications that can impact the liver are antipsychotics, specifically risperidone and quetiapine, marketed under the name Seroquel. These antipsychotic medications are not only utilized in the treatment of psychoses but are also employed for cases of refractory depression, which refers to depressions unresponsive to conventional treatment. Both risperidone and quetiapine carry the potential to cause liver damage, primarily through a process known as drug-induced cholestasis. This condition occurs when there's an interruption or reduction in the flow of bile from the liver, crucial for fat digestion and waste elimination. When medications like risperidone and quetiapine interfere with this process, bile can accumulate in the liver, leading to potential hepatic damage. Therefore, patients undergoing treatment with these medications should undergo careful monitoring for any signs of liver problems to ensure early detection and intervention. The second medication known to potentially affect the liver is methyldopa. Methyldopa is commonly prescribed to manage high blood pressure and is particularly favored for its safety, being the most prescribed medication for pregnant women with hypertension. Despite its overall safety profile, methyldopa has been associated with potential liver damage. As such, its use is not recommended for individuals with pre-existing liver conditions such as fibrosis or cirrhosis. It's important to note that adverse effects on the liver can manifest up to 12 weeks after initiating treatment with methyldopa. Regular monitoring of patients using this medication is crucial to promptly detect any signs of liver impairment. This monitoring helps prevent deterioration and ensures that hypertension treatment does not inadvertently harm liver health. Patients with a history of liver diseases should engage in discussions with their healthcare providers to explore safer alternative treatment options. The top drug on the list is paracetamol, which is widely recognized as the leading cause of drug-induced liver failure. Typically, liver injury isn't triggered by the standard dosage but rather by excessive doses. Unfortunately, due to its widespread availability, some individuals misuse paracetamol, taking more than the recommended amount. For instance, instead of adhering to the appropriate dosage for a headache, they might ingest 3 tablets at once, repeating this overdose pattern. It's crucial to underscore that when taken as directed, paracetamol is safe. Doctors routinely prescribe it to infants to alleviate fever or pain without encountering issues. However, surpassing the recommended dose can be perilous. Shockingly, more than a third of liver failure cases attributed to medications are linked to paracetamol. An overdose of paracetamol can precipitate acute liver failure, which carries a high mortality rate and often necessitates a liver transplant if the organ fails to regenerate itself. Unlike the kidneys, where hemodialysis can sometimes reverse renal failure temporarily, the liver typically requires a transplant once compromised. Moreover, factors like alcohol consumption, genetic predisposition, and concurrent intake of other medications on the list can heighten the risk of liver injury. Liver damage from paracetamol typically initiates within 1 to 3 days following ingestion, with symptoms manifesting 2 to 4 days later. Fortunately, an antidote for paracetamol overdose exists: acetylcysteine, also known as Fluimucil, which serves as an expectorant and is used for certain cases of OCD and trichotillomania. This antidote proves effective in safeguarding the liver against paracetamol overdose. However, if you've exceeded the recommended dosage, it's imperative to seek immediate medical attention at an emergency room and explain the situation to the doctor, rather than risking the need for a liver transplant. It's essential to recognize that just because a medication isn't listed here doesn't mean it can't cause liver damage. Vigilance and adherence to prescribed dosages are paramount to protecting liver health. The roster of medications carrying hepatotoxic potential is expansive, encompassing antiretrovirals, vitamins like niacin, various antibiotics, supplements, and even herbal teas, a topic explored in a separate video. Given the liver's pivotal role in bodily functions, any malfunction can have far-reaching consequences. Thus, exercising extreme caution when using medications is paramount to prevent drug-induced hepatitis and, in severe instances, fulminant hepatitis. Fulminant hepatitis represents a grave complication affecting a notable fraction of individuals with acute drug-induced hepatitis, often characterized by symptoms like jaundice and yellowing of the skin. Shockingly, among these cases, only approximately 20% survive without the necessity of a liver transplant. This underscores the critical importance of vigilant medication use and prompt medical intervention to safeguard liver health and overall well-being. 7 Natural strategies for effective liver detoxification. Today, we delve into the science of naturally detoxifying and cleansing one of the human body's most crucial organs, the liver. Are you prepared for this enlightening journey? Let's embark on it together. The liver, an organ of paramount importance in the human anatomy, primarily functions to eliminate toxins produced daily by our bodies. In modern diets, heavily laden with processed foods and synthetic additives, the liver is often burdened, necessitating increased efforts to maintain optimal functionality. At this juncture, the question arises, is it feasible to detoxify the liver? Briefly, yes, it's possible, but it's imperative to approach this topic with discernment. A cursory internet search reveals a plethora of liver detox products, including vitamins, pills, teas, and oils, all claiming rapid and significant results. However, the efficacy of these products remains a topic of debate. While I cannot categorically comment on their effectiveness, I urge you to conduct thorough research on their ingredients and consult your healthcare provider before starting any supplement regimen. It's noteworthy that many liver detox products on the market are not approved by the Food and Drug Administration, FDA, a fact that warrants consideration. In this discussion, our focus will be on natural foods and supplements that can aid in liver cleansing. I strongly advise seeking medical counsel and not initiating any dietary or supplement changes without prior consultation with your healthcare provider. With this crucial advisory in place, let us explore how to naturally detoxify your liver. Firstly, let's discuss the critical role of dietary fiber in liver health. Fiber, a vital component for optimal digestion, plays a significant role in aiding the body's natural detoxification processes. Regrettably, many modern diets fall short in fiber content as foods are often processed, stripping them of their natural, beneficial fiber. This deficit hinders the body's ability to eliminate toxins efficiently. In the absence of adequate fiber, toxins accumulate, burdening the liver, an outcome far from desirable for liver health. To counteract this, one can effectively support liver function by simply increasing fiber intake. Incorporating a variety of fruits and vegetables into your diet is a straightforward strategy to enhance fiber consumption. This not only contributes to a more balanced diet but also provides substantial support to liver health. I understand that not everyone enjoys fruits and vegetables, particularly if you have selective eating preferences. For those who find it challenging to incorporate these into their diet, there are palatable and healthy alternatives. Secondly, let's consider the habitual consumption of green tea, a beverage with numerous health benefits. Many of us rely on caffeine to navigate through our daily routines. While there are various sources of caffeine, green tea stands out due to its unique health properties. Green tea is rich in catechins, potent antioxidants that offer substantial benefits to liver health. Regular consumption of green tea, ideally 2 to 3 cups daily, can aid in detoxifying the liver. In addition to liver health, green tea contributes to a myriad of other health benefits, making it a valuable addition to your daily regimen. Thirdly, let's talk about incorporating garlic into your diet. Garlic, a well-regarded ingredient across various cultures and cuisines, is not only flavorful but also packed with health benefits. It contains essential amino acids and compounds that activate liver enzymes, facilitating the removal of toxins from the body. Additionally, garlic is a source of selenium, a potent antioxidant. Introducing garlic into your cooking is an effortless yet effective way to support liver detoxification. While some may find the taste of garlic strong or unappealing, garlic supplements are a viable alternative. Moreover, vitamin C is instrumental in the synthesis of certain enzymes. These enzymes are vital for the liver as they facilitate the elimination of toxins. The liver's ability to process and remove harmful substances from the body is greatly enhanced by the presence of these enzymes, which are supported by adequate levels of vitamin C. Therefore, incorporating citrus fruits into your diet can have a dual benefit, boosting your immune system and supporting liver function. This can be achieved by including these fruits in your daily meals, whether as part of breakfast, as a snack, or even incorporated into salads and other dishes. Fifth, let's consider turmeric, a spice celebrated worldwide for its flavor and health benefits. Originating from Asia and a staple in Indian cuisine, turmeric's therapeutic qualities have gained recognition recently. Personally, I vouch for its positive impact on health. While turmeric offers numerous health benefits, its role in liver health is particularly notable. It is believed to stimulate the regeneration of liver cells. However, it's important to remember that turmeric should complement, not replace, medical treatments prescribed by your doctor. To incorporate turmeric into your diet, use it as a spice in cooking, or add it to tea or milk. While my preference is to take turmeric supplements, it also enhances the flavor of dishes like curries and stir-fries. Number 6. Incorporating nuts into your daily diet presents numerous benefits for liver health, a fact that is often overlooked in discussions about nutrition and wellness. Nuts, and particularly walnuts, are a powerhouse of nutrients essential for the optimal functioning of the liver. Let's delve into the specific components that make nuts, especially walnuts, so beneficial. They are abundant in proteins, which are vital for repairing and building liver cells. Proteins also play a key role in the synthesis of enzymes that the liver uses in its detoxification processes. Amino acids, the building blocks of proteins, are another crucial component found in nuts. They assist in various liver functions, including detoxification. Arginine, an amino acid present in nuts, is particularly noteworthy. It aids in the liver's detoxification process by helping to neutralize ammonia, a byproduct of protein metabolism. Moreover, walnuts are a rich source of omega-3 fatty acids. These essential fatty acids are known for their anti-inflammatory properties, which are beneficial in managing liver inflammation and promoting overall liver health. Omega-3s also help in reducing the accumulation of fats in the liver, thereby preventing conditions like fatty liver disease. The recommendation is to include a daily handful of nuts, preferably organic and unprocessed, in your diet. The emphasis on organic and unprocessed varieties is due to their higher nutritional value and absence of harmful additives or preservatives, which could otherwise counteract the liver protective benefits. Finally, the 7th recommendation is to increase your consumption of leafy green vegetables. These vegetables, which include spinach, kale, lettuce, broccoli, cabbage, and bok choy, are not only high in fiber but also contain compounds that aid the liver in breaking down larger molecules, facilitating easier toxin elimination. Incorporating these vegetables into your diet can lead to noticeable improvements in your energy levels and overall well-being within a week. In conclusion, you are now equipped with knowledge on how to naturally detoxify your liver, an essential organ with remarkable functions. the liver's ability to process and eliminate toxins is indeed a marvel of human physiology, underscoring the importance of maintaining its health. The dietary components we've explored in this session are specifically chosen to support and enhance liver function. These include high-fiber foods, antioxidants, and nutrients essential for liver health. Each item we've discussed plays a unique role in aiding the liver's detoxification processes, thereby contributing to overall health and well-being. However, it is crucial to approach any dietary changes or supplement introductions with caution. I cannot overstate the importance of consulting with your healthcare provider before making any adjustments to your diet or health regimen. This is especially true if you have pre-existing health conditions or are on medication, as even natural foods and supplements can interact with medicines and affect your health. Repairing your liver. Top 8 vitamins to include in your diet. The liver stands as a cornerstone in the intricate machinery of the human body, processing a staggering 1.7 liters of blood each minute. Its role in maintaining overall health cannot be overstated. To ensure your well-being, it is imperative to prioritize the nourishment of your liver by incorporating the right foods and essential nutrients into your diet. By doing so, you enable this vital organ to effectively neutralize toxins, rendering them harmless. Among its multifaceted responsibilities, the liver manufactures bile to facilitate the removal of waste and break down dietary fats. Furthermore, it serves as a repository for fat-soluble vitamins, including A, D, E, K, and B12, in addition to orchestrating over 500 other critical bodily functions. Regrettably, if you are overweight, there is a high probability that your liver is congested, harboring fatty deposits that impede its optimal functioning. Over time, a fatty liver can lead to further complications such as weight gain, elevated blood pressure, heart attacks, strokes, and ultimately, liver cirrhosis. Fortunately, nature provides us with a repertoire of vitamins and compounds that can not only repair existing liver damage, but also bolster its multifaceted roles in safeguarding your health. In this discourse, I employ the term vitamins broadly, encompassing amino acids, enzymes, and natural remedies, all of which contribute to the revitalization of your liver. Before delving into the specifics of these beneficial nutrients, it is essential to be vigilant and recognize potential signs of liver distress. These indicators can serve as valuable early warnings. Individuals afflicted with a fatty liver often experience discomfort and tenderness in the right shoulder region due to the pressure exerted by the congested liver on the phrenic nerve. Additionally, post-meal sensations of pressure or fullness beneath the right rib cage may manifest, hinting at a deficiency in bile production, a topic we will explore further in this presentation. Liver-related issues may also manifest as swelling in the right foot and ankle. Furthermore, the presence of spider veins on the skin can be attributed to the toxic accumulation of hormones within the liver. Lastly, abdominal obesity is a telltale sign that fat has infiltrated the liver, spilling over into the abdominal cavity. While these are some of the more common symptoms associated with liver problems, it is important to note that there are numerous other indicators one should remain vigilant of. The initial and arguably the most crucial nutrient for liver health is choline. Choline gained recognition as an indispensable component of our diet back in 1998, when researchers unveiled its pivotal role in preventing fatty liver disease and mitigating muscle damage. Incorporating a daily supplement of 300 milligrams of CDP choline into your regimen can be instrumental in eradicating unwelcome fat deposits from the liver, thereby averting or even reversing fatty liver disease. This is primarily achieved by enhancing the composition of bile produced within the liver. Bile essentially functions as a detergent in the body, facilitating the dissolution and breakdown of dietary fats. Alternatively, you can also boost your choline intake by including foods such as beef liver, organ meats, eggs from pasture-raised hens, cauliflower, broccoli, Brussels sprouts, cabbage, and dairy products sourced from grass-fed animals into your diet. The second element on our list is methionine. Now, methionine is a sulfur-based amino acid, a crucial building block for various bodily functions, particularly liver health. It plays a pivotal role in aiding the liver's self-repair mechanism, facilitating the detoxification of harmful substances within your body, including substances like acetaminophen, which can pose a threat when taken in excess. Some of the most potent sources of methionine include eggs, sesame seeds, Brazil nuts, grass-fed cheese, chicken, and tuna. By incorporating these into your diet, you're essentially providing your liver with the necessary components to enhance its production of glutathione, an exceptionally potent antioxidant. Glutathione operates as a formidable ally in reducing inflammation not only within the liver but also throughout your entire body. This reduction in inflammation can lead to decreased pain and swelling in your joints, as well as aiding in the breakdown and elimination of alcohol from both the bloodstream and the liver. Moreover, it actively contributes to the production of crucial neurotransmitters in your brain, thereby promoting overall cognitive well-being. Moving forward, let's delve into bile salts. As mentioned earlier, your liver is responsible for producing bile, a vital liquid that aids in the digestion and breakdown of dietary fats into smaller, more absorbable particles. This process is essential for the absorption of fat-soluble vitamins such as A, D, and E, alongside other fat-soluble nutrients. Regrettably, in cases of liver damage, bile can transform into a viscous substance, often referred to as sludge, exerting pressure on your gallbladder and bile ducts. To counter this, incorporating a daily supplement of bile salts and digestive enzymes into your regimen can effectively thin out the bile and help dislodge fatty deposits within your liver. Now, let's return to number 4, which involves a noteworthy phytonutrient known as sulforaphane. Sulforaphane is a crucial compound found abundantly in cruciferous vegetables like broccoli, Brussels sprouts, radishes, cabbage, cauliflower, and kale. Inflammation within the liver can potentially lead to complications such as insulin resistance, diabetes, cancer, and other life-threatening ailments if left unaddressed. However, a regular intake of raw cruciferous vegetables can serve as a formidable ally in mitigating inflammation. By supporting optimal liver function, sulforaphane actively aids in detoxifying the liver from the accumulated residues of caffeine, medications, environmental chemicals, and toxins. It's imperative to note that cooking these vegetables can diminish the enzymatic activity required to activate sulforaphane in your body. Therefore, whenever feasible, opt for raw consumption. An intriguing fact to consider is that broccoli sprouts, cauliflower sprouts, and radish sprouts contain approximately 100 times more accessible sulforaphane compared to their fully grown counterparts. So, go ahead and incorporate these sprouts into your salads to witness substantial enhancements in your overall health. Number 5 on our list focuses on tocotrienols, a subtype of vitamin E. Over time, liver damage can lead to the accumulation of scar tissue, hindering the proper functioning of liver cells. Tocotrienols, found naturally, offer a solution by reducing scar tissue not only in the liver but throughout the body. Consider incorporating tocotrienols into your daily routine via a supplement derived from natto, a soybean-based product. These remarkable compounds not only dissolve liver scar tissue but also serve as potent antioxidants, aiding in the repair of liver injuries and mitigating inflammation, thus preventing further harm. Moving on to number 6, we have the spice turmeric. Curcumin, a component of turmeric, possesses powerful anti-inflammatory properties that are beneficial for the liver and the body as a whole. It's often hailed as a natural painkiller due to its ability to boost antioxidant activity in the liver. Taking a daily 2,000 mg turmeric supplement can assist the liver in detoxifying heavy metals like lead, mercury, and cadmium, while also promoting liver regeneration. Now, don't underestimate the importance of number 7, vitamin D. A deficiency in vitamin D can contribute to the development of fatty liver disease. Our skin synthesizes vitamin D when exposed to sunlight. Given the widespread deficiency in this vitamin worldwide, it may be prudent to supplement with 10,000 international units of vitamin D3 daily. Vitamin D3 not only reduces liver inflammation and swelling but also enhances bile production. This naturally leads to a reduction in liver fat, fibrosis, scar tissue, and aids in the treatment and prevention of hepatitis, a viral infection that affects the liver. Lastly, the crown jewel of liver protection is glutathione, the master antioxidant produced by your liver. You can also increase your glutathione levels by including certain foods in your diet, such as turkey tail mushrooms, oyster mushrooms, avocados, and asparagus. Glutathione plays a pivotal role in safeguarding your entire body from free radical damage, making it crucial for maintaining a healthy liver. To support your liver health, consider these 3 steps. Incorporate sulfur-rich foods like cabbage, cruciferous vegetables, garlic, onions, bone broth, grass-fed beef, walnuts, and watercress into your diet. These foods elevate glutathione levels, offering protection against free radical damage in the liver. Consume selenium-rich foods like Brazil nuts, tuna, sardines, halibut, eggs, and organ meats to further boost glutathione levels. Integrate whole milk thistle powder into your daily routine, taking it 3 times a day. This herbal remedy is among the best natural substances for increasing glutathione levels and aiding in the recovery from fatty liver disease, fibrosis, and inflammation. Now, let's discuss foods that should be avoided, as they can harm the liver. Stay away from vegetable oils like corn, soy, cottonseed, and canola oil, as these can trigger significant inflammation within liver cells. Eliminate sugar and corn syrup from your diet, as they deplete your antioxidant reserves, rendering your liver more susceptible to inflammation and infection. Alcohol is another culprit, damaging hepatocytes and increasing the risk of cirrhosis and cancer. Furthermore, be cautious with painkillers like acetaminophen or paracetamol, as they can poison the liver and deplete glutathione levels. While not a food, concentrated protein powders and power bars can also cause liver cell damage, particularly when consumed without adequate fat, leading to an ammonia buildup. In summary, your liver is a remarkably resilient organ capable of self-repair and restoration, even after experiencing liver disease. To help your liver recover, consider incorporating a combination of the nutrients and antioxidants discussed here. Additionally, adopting an intermittent fasting plan such as OMAD, where you consume all your calories within a shorter time window, can stimulate a process called autophagy, facilitating the removal of old and damaged liver tissues, promoting liver cell health. Finally, adopting a low-carbohydrate diet and increasing your intake of raw cruciferous vegetables can be an exceptionally effective way to cleanse and rejuvenate your liver. Easy Liver Cleanse. Discover the 1 cup a day solution to reduce liver fat. The liver, often underestimated, plays a pivotal role in maintaining our health. It's imperative to recognize that a substantial portion of the population is afflicted with fatty liver disease, a condition often undiagnosed until revealed through imaging techniques like ultrasound or CAT scans. This revelation usually comes as a surprise to many. Understanding the liver's functions and the significance of reducing hepatic fat is crucial. There are simple yet effective strategies that one can employ to mitigate this issue, including dietary interventions. I'll discuss a specific concoction that can be prepared daily to aid in this process, underpinned by solid scientific evidence. Relevant resources and detailed explanations of each ingredient will be provided for further understanding. A common misconception is that bile, essential for the digestive process, is produced by the gallbladder. In reality, the liver is responsible for bile production, with the gallbladder merely storing it. Bile's role is vital. It acts as a detergent, facilitating the breakdown of fats. This process is more intricate than it appears. For instance, consider the digestion of dietary fats. Once consumed, these fats pass through the stomach and into the small intestine. While the stomach initiates the breakdown, the gallbladder aids this process by releasing bile. Bile, in turn, prepares the fats for further breakdown by pancreatic enzymes, particularly lipase. This enzyme, specialized for fat digestion, requires bile's assistance to effectively perform its function. Bile increases the surface area of fats, allowing lipase to more efficiently catalyze their digestion, facilitating better nutrient absorption in the small intestine. Inadequate bile production impairs this process, leading to nutritional deficiencies. For example, a deficiency in vitamin A, first manifesting as night blindness, can be a direct consequence. Difficulty in seeing under low light conditions, such as during nighttime driving in the rain, can be an early indicator. Beyond vision, vitamin A plays a crucial role in immune function, particularly in combating sinus issues. Similarly, a lack of vitamin E can adversely affect heart health, potentially leading to increased inflammation, arterial calcification, and elevated cholesterol levels. These symptoms should not be underestimated, as they can signify broader health issues. Vitamin D deficiency, another potential outcome of inadequate bile production, can have far-reaching consequences. This vitamin is essential for pain reduction, blood pressure regulation, bone formation, and calcium absorption in the small intestine. Without sufficient vitamin D, calcium absorption plummets, leading to bone health issues, sleep disturbances, and other complications. Furthermore, vitamins K1 and K2 deficiencies can lead to easy bruising, bleeding issues, and calcium accumulation in arteries and joints, respectively. These vitamins play a critical role in blood clotting and calcium regulation. Lastly, the importance of omega-3 fatty acids cannot be overstated. These essential fats are vital in controlling inflammation. A deficiency can lead to various inflammatory conditions, including arthritis, heart problems, and even cognitive impairments due to their significance in brain health. In summary, the liver's health is integral to our overall well-being, influencing various aspects of our physiological functioning, from fat digestion to nutrient absorption and regulation. Its role in maintaining our health is indispensable, and it warrants our utmost attention and care. Bile, a crucial liver secretion, plays a vital role in regulating cholesterol levels in the body. For example, when someone adopts a ketogenic diet for weight loss, fat cells release triglycerides and cholesterol. While triglycerides can be utilized for energy, cholesterol cannot. Here, bile is essential in aiding the elimination of excess cholesterol. A deficiency in bile due to compromised liver function can lead to gallstones, which are essentially crystallized cholesterol formed due to insufficient bile to emulsify and break it down. Moreover, bile salts are integral in detoxifying the body. The liver's primary function is not to store toxins but to neutralize them. Without adequate bile, the body struggles to process and eliminate these toxins, leading to an increase in toxic substances circulating in the bloodstream and body. Thus, optimal liver function is paramount for effective detoxification. An enlarged liver, a symptom of fatty liver disease, can cause physical discomfort. As the liver grows heavier, it no longer fits properly in its designated space on the right side of the body, leading to pressure and pain in the neck and right shoulder, as well as a sense of fullness under the right rib cage. The liver's role extends beyond detoxification to metabolic functions, particularly in thyroid hormone conversion. It is responsible for converting T4 to T3, the active form of thyroid hormone. A dysfunctional liver may impair this conversion process, leading to suboptimal levels of T3 and potential thyroid issues, despite the presence of hormones. The liver's efficiency in this conversion process is crucial, as it handles approximately 80% of T3 activation. Additionally, the liver plays a key role in regulating sex hormones like estrogen and testosterone. An imbalance in these hormones, due to inadequate liver function, can lead to various health conditions. For instance, in women, it might contribute to polycystic ovarian syndrome, characterized by an excess of androgens, or in men, an imbalance can lead to issues like abnormal breast tissue growth and low testosterone levels. Therefore, maintaining liver health is not just about preventing gallstones or managing cholesterol, it's also about ensuring the effective functioning of numerous other bodily processes, including hormone regulation and detoxification. A healthy liver is a cornerstone of overall well-being. As a health expert, I would like to provide an enhanced perspective on the importance of bile and how to recognize symptoms of low bile production, crucial for optimal liver function and fat digestion. Firstly, difficulty in digesting fats, indicated by bloating after consuming fat-rich foods, can be a sign of inadequate bile production. Bile is essential for breaking down fats, and its insufficiency can lead to digestive discomfort. Observing stool characteristics offers valuable insights. Light-colored, pale, or gray stools, particularly if they float or leave skid marks, may indicate a bile deficiency. This is because bile imparts color to the stool and aids in fat breakdown, affecting stool consistency and buoyancy. Another symptom of low bile is a lack of satiety after meals, possibly due to inefficient fat absorption. This can lead to a persistent feeling of hunger as the body struggles to signal fullness to the brain. Common digestive issues like nausea, indigestion, and especially bloating, burping, or belching can also be indicative of low bile production. These symptoms suggest a disruption in the normal digestive process, where bile plays a pivotal role. Understanding the significance of bile extends to managing liver health, particularly in preventing fatty liver disease. Enhancing bile production can be a strategic approach to maintain liver health. Some individuals opt for purified bile salt supplements, which can support this process. In addition to dietary adjustments, I recommend a simple, nutritious shake to support liver health. This shake is particularly effective in conjunction with a ketogenic diet and intermittent fasting, which can significantly reduce liver fat. The shake's ingredients are straightforward: kale, blueberries, and kefir. These should ideally be organic and frozen for ease of blending and enhanced taste. Kale and blueberries are rich in quercetin, a potent nutrient for combating fatty liver. They also provide other beneficial compounds for liver health. To prepare, blend 2 cups of frozen kale, 1 cup of frozen blueberries, 1 cup of water, and 1 cup of plain whole-fat kefir. Avoid flavored or sweetened kefir, opt for organic, grass-fed varieties if possible. The kefir adds necessary probiotics for liver health. Once blended, this shake not only tastes great but is also highly effective in reducing liver fat. Consuming it daily, along with a healthy ketogenic diet and intermittent fasting, can significantly improve liver health and function. Top 12 liver cleansing superfoods for your diet. The liver is a powerhouse organ, responsible for filtering toxins out of your blood, aiding in digestion, and much more. But sometimes, it can become overburdened. When the liver is stressed, it can lead to issues like fatigue, jaundice, and even conditions like non-alcoholic fatty liver disease. The consequences of an overwhelmed liver can be serious, impacting your overall health. And the risks? Not to be taken lightly. Poor diet, excessive alcohol consumption, and exposure to harmful substances can all put your liver at risk. Now, you might be wondering, what causes the liver to need a detox? Well, our modern lifestyle can be tough on our livers. Processed foods, less than healthy eating habits, and environmental toxins all play a part. But here's the good news: we can support our liver with the right choices, and that brings us to the highlight of today's video, the 12 superhero foods that can help detox your liver. Now, let's explore our first food item, which is the grapefruit. Grapefruit contains 2 important antioxidants, naringin and naringenin, which have been studied for their liver protective abilities. Naringenin has the effect of metabolizing lipids in the liver, helping to reduce fat accumulation and enhance calorie burning capacity. This may aid in the prevention and management of conditions such as non-alcoholic fatty liver disease, NAFLD. Additionally, vitamin C and other antioxidants in grapefruit help protect liver cells from damage caused by free radicals and may support the liver's natural cleansing process, boosting the body's ability to eliminate toxins. The next food we will mention is kale. Kale, also known as kale, is a type of dark green leafy vegetable that falls into the nutritionally dense leafy green category. It is a member of the Brassica family, related to broccoli and Brussels sprouts. Kale is not only famous for its distinctive flavor but also known for its high nutrient content, including vitamin C, vitamin K, iron, fiber, and a wealth of antioxidants. Kale contains a significant amount of antioxidants and anti-inflammatory compounds such as quercetin and camphorol. These compounds may help reduce inflammation in the body, including the liver. Kale is also rich in glucosinolates, substances that the body metabolizes into compounds that promote liver detoxification processes, thereby helping to remove harmful substances. Moreover, vitamin K in kale plays a critical role in blood clotting and may help protect the liver from damage and diseases related to abnormal cell growth. The third food is the tomato. Tomatoes are one of the most popular fruits worldwide, belonging to the nightshade family. Though often treated as a vegetable in cooking, tomatoes are actually the fruit of the tomato plant. They can range from green to bright red when ripe and are known for their high content of vitamin C, potassium, folate, and antioxidants, particularly lycopene. Lycopene is a carotenoid that provides the distinctive red color to tomatoes and has been extensively studied for its health benefits. Lycopene in tomatoes has strong antioxidant properties, helping to reduce oxidative stress and prevent liver cell damage. Studies indicate that lycopene may protect the liver from damage by toxins such as alcohol and may help reduce inflammation. Compounds in tomatoes also help promote the liver's detoxification process, thereby supporting the elimination of toxins. A balanced diet often includes tomatoes in various meals, whether as whole fruits, in salads, or as part of cooked dishes. For a healthy adult, consuming about 1 to 2 medium-sized tomatoes daily can be part of a healthy diet. However, it should be noted that tomatoes contain high levels of potassium, so those with kidney issues or on a potassium-restricted diet should discuss with their doctor before increasing their intake. The fourth food is the carrot. Most known for its high beta-carotene content, carrots are also a good source of vitamins A, C, K, and B8, along with pantothenic acid, folate, potassium, iron, copper, and manganese. Carrots can be consumed raw, cooked, or used in juices and smoothies, making them an extremely versatile food in the daily diet. Beta-carotene, an antioxidant found in carrots, converts to vitamin A in the body. Vitamin A is an important nutrient that supports liver function and improves liver health. It helps protect the liver from inflammation and oxidative stress, as well as aids in the repair and regeneration of liver cells. Moreover, the fiber in carrots can help improve digestive function, thus supporting the process of waste and toxin elimination through the intestines. However, due to the high beta-carotene content in carrots, excessive consumption may lead to a yellow-orange discoloration of the skin, although this is not harmful to health and can be reversed by reducing intake. Next is the apple. Apples are not only tasty but also rich in fiber, vitamin C, and various other antioxidants such as quercetin. Apples also contain small amounts of vitamin A, calcium, and iron, making them a beneficial addition to any healthy diet. The antioxidants and soluble fiber in apples, particularly pectin, help support liver function by reducing the liver's workload and promoting the elimination of toxins from the body. Pectin binds to toxins and heavy metals in the gut, aiding in their removal through the digestive process. Additionally, quercetin, an antioxidant found in apples, has been shown to help reduce inflammation and protect liver cells. The sixth food is broccoli. Broccoli is a cruciferous vegetable, known not just for its distinctive shape but also for its high nutritional value. Sulforaphane in broccoli stimulates the production of enzymes in the liver, which helps eliminate toxins and reduce oxidative stress. These enzymes play a crucial role in protecting the liver from damage and supporting the liver's natural detoxification process. Broccoli may also improve liver health by reducing inflammation and preventing the accumulation of fat in the liver, which is beneficial in the management of conditions like non-alcoholic fatty liver disease. In conclusion, incorporating these foods into your diet can support liver health, but it's important to maintain a balanced diet and lifestyle for overall well-being. Keep in mind that individuals with specific health conditions should consult healthcare professionals before making significant dietary changes. The seventh food item is pumpkin. Pumpkin is a nutritional powerhouse, rich in beta-carotene, a precursor to vitamin A, vitamin C, and fiber. It also contains important minerals like potassium and manganese, along with other antioxidants such as lutein and zeaxanthin. The antioxidant beta-carotene and other compounds in pumpkin may help protect the liver from free radical damage, reduce inflammation, and promote liver cell regeneration. Beta-carotene and other antioxidants enhance overall health and may support the liver's natural functions in detoxifying and eliminating toxins from the body. Additionally, pumpkin is low in calories and high in fiber, which supports healthy digestion, also crucial for reducing the strain on the liver. The eighth food is pomegranate. Characterized by its vibrant red color, pomegranate contains many juicy seeds, each encased in a sweet flesh. Pomegranate is an excellent source of antioxidants, including tannins, anthocyanins, and ellagic acid, as well as vitamin C, vitamin K, and fiber. The rich antioxidants in pomegranates, especially tannins and anthocyanins, may help reduce oxidative stress in the liver, thereby protecting liver cells from damage. Ellagic acid, another compound found in pomegranates, may support the liver detox processes and could inhibit the formation and growth of cancer cells in the liver. Furthermore, pomegranates also support anti-inflammatory processes, which are important in maintaining liver health. The 9th food item is avocado. Avocado is a popular fruit cherished for its creamy taste and smooth texture. Not just a versatile ingredient in cooking, avocado is also known as a superfood due to its high content of monounsaturated fats, particularly oleic acid, a heart-healthy fat. Avocado also contains plenty of vitamin E, potassium, and fiber. The monounsaturated fats in avocados may help reduce inflammation, a key factor in preventing and managing liver diseases. Vitamin E, a strong antioxidant, helps protect liver cells from free radical damage. Avocados also contain phytochemicals that may support liver health by enhancing the detoxification of toxins and reducing the burden on the liver. Integrating avocados into the diet should be done in moderation due to their high calorie and fat content, although it is a healthy type of fat. A common serving size is about 1/4 to 1/2 of an avocado each day. This equates to about 30 to 50 grams of avocado. Avocados can be added to salads, toast, smoothies, or even eaten directly after sprinkling a bit of salt and pepper to enhance the flavor. The 10th food item is beetroot. Beetroot, also known as beet, is a deeply colored vegetable often used in salads, juices, and even in cooking soups. Beetroot is known for supporting detoxification and purification of the body, particularly the liver. Betaine, a compound found in beetroot, helps protect the liver from damage and promotes liver cell regeneration. Additionally, this compound also reduces the accumulation of fat in the liver, which can help prevent diseases related to the liver such as fatty liver disease. The combination of antioxidants and fiber in beetroots also helps boost the immune system and the process of eliminating toxins from the body. The 11th food item is walnuts. Walnuts, or walnut, are nuts harvested from the walnut tree, belonging to the Juglanaceae family. They have been studied for their ability to improve liver function due to their high omega-3 fatty acid content. These fats help reduce inflammation, a factor that may contribute to various liver diseases, including hepatitis and non-alcoholic fatty liver. Additionally, the antioxidants in walnuts help protect liver cells from oxidative damage. The abundance of antioxidants and healthy fats makes walnuts a good addition to a diet aimed at supporting liver health. Although walnuts are very nutritious, they are also high in energy due to their high fat content, so they should not be consumed in large amounts. The recommended dose is about a handful, around 28 to 30 grams, per day. This provides a good amount of nutrients without overloading on calories. Walnuts can be added to salads, used as a snack, or incorporated in dishes like bread and baked goods. The 12th food item is salmon. Salmon is a type of cold water fatty fish widely consumed and known for its abundant omega-3 fatty acids. These fatty acids not only help reduce inflammation in the body but can also decrease fat in the liver and lower the risk of non-alcoholic fatty liver disease, NAFLD. This may reduce the risk of cirrhosis and other liver diseases. Moreover, the omega-3s in salmon also help maintain the structure of liver cells and immune function. However, it is recommended to consume salmon at least twice a week. A serving size of about 3 to 4 ounces, 85 to 113 grams, is considered appropriate. Each of these foods has unique properties that help support the liver cleansing process, but always remember that their consumption should be in conjunction with a balanced diet and a healthy lifestyle. For any changes related to diet or health, be sure to discuss with a doctor or nutrition expert for specific guidance. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous,